Medicare Hospital benefit. What does that entail? What does that cover? Hi, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. A lot of people are wondering about the hospital benefit under original Medicare. About 46 million searches will come up if you put in Medicare hospital benefit. So that tells me, and there's about 50 million people on Medicare, so that tells you just about everybody at some point is asking about what is the hospital benefit. I normally don't dig this deep into Medicare, but I thought I would because I've had some clients that have recently gone in the hospital, including one that had only been on Medicare for about a week. And her husband called and said, "We don't have our Medicare supplement cards yet, and the hospital wants to know what we've got, the name of the carrier and all this kind of stuff, and I need you to help me." All right, first off, the hospital doesn't need your Medicare supplement card, neither does a doctor, because they're not going to bill your Medicare supplement carrier. They're going to send the bill to Medicare. It's not going to stop them from asking about it, and I'll tell you, I have been on Medicare for 4 years now. I have never carried my Medicare supplement card with me. I carry original Medicare and I carry my drug plan card, but I've never carried my Medicare supplement carrier ID card. I've had a few people ask me for it. I tell them, no, I don't have it. And they say, okay, we'll bring it in next time you come. And I never do. So that's the stubbornness in me, I guess you might say. But they don't need it. And again, it's because they are not going to bill your supplement carrier. And most of the time, if you say, I've got a G plan, I've got an F plan, they have no idea what that means. So, just don't worry about it. But the hospital benefit, this is Medicare Part A. We're talking original Medicare. We're not talking about Advantage plans. Well, what's covered? Well, there is in 2019, it's a $1,364 per admission deductible. That's Medicare deductible. And after that, everything that is incurred in the hospital and billed by the hospital for the next 60 days goes direct to Medicare, and Medicare pays for it. So you're only responsible for that first $1,364 deductible. Now, if you have a Medigap plan, Medigap, Medicare supplement, interchangeable terms, but if you have a Medigap plan, most of the plans, particularly the G plan, which is currently the most popular plan out there, but most of the plans will cover that Part A deductible. So that means if you go in the hospital and you stay for 2 months, you should have zero out of pocket as far as your treatment in the hospital by hospital staff. Now, that being said, if you're in the hospital, there's probably a doctor outside of that's not on staff. Maybe it's your personal doctor. Maybe it's somebody that the hospital has contracted with. There are hospitalists, I think is the term. There's physician's assistants. There's other people who may come to talk to you while you're in the hospital, either the emergency room or in the hospital portion, and they may not be on staff there at the hospital. So you will, while you're a hospital inpatient, you most likely will have bills that will fall under Medicare Part B. These are providers who are not on staff at the hospital. They are billing you separately from the hospital. So, hospital Part A, usually not a big deal, especially if you have a Medicare supplement plan. One of the other questions that will come up from time to time is, does Medicare have to approve my hospital stay? No, they don't. If it's an emergency, nobody calls them up and says, can we send her to the hospital? But beyond that, there's a lot of planned procedures that have to be done on an inpatient basis. And no, Medicare does not approve that. Medicare does not get involved in pre-authorization. They don't insert themselves between you and your doctor and say, or just you and just logic, hey, I think I'm having a heart attack, I better go to the emergency room. Medicare does not get involved in that. They don't do any pre-certification, any pre-authorization. You go because you feel like you have an emergency, or your doctor says you need to go in the hospital. So that's one benefit of original Medicare that you do not get with Advantage plans. Outside of an emergency, anytime you go to the hospital because your doctor says you need to have this and you need to have that, Medicare Advantage plans have a pre-authorization process, and they have to agree with. Your doctor would file a form, notify your insurance carrier. This is, again, Medicare Advantage. And they'll say, well, we don't think that Bob needs to go to the hospital, or, yeah, it's okay, but only for 2 days, that type of thing. So original Medicare, if you're in the hospital, you will have generally no out-of-pocket for hospital incurred and billed charges. You will have outpatient charges from doctors and other providers who have seen you there, and that falls under Medicare Part B. And the Medicare Part B people, well, under Medicare Part B, especially if you have a G plan, your out-of-pocket in 2019 is $185. That's a calendar year deductible. After that, Medicare pays 80%. Your G plan, Medigap plan, pays the other 20%. So if you go in the hospital and you have charges in the hospital, you have charges while you're in the hospital, but by people who are not affiliated with it, you are going to have some out-of-pocket, but it's not going to be anything exceeding the calendar year deductible, which again in 2019 is $185. Nor does Medicare insert themselves in that process, and they're not going to deny charges that are medically necessary and justified by whoever's doing the billing. So that's pretty much the way it is. It's a very simple process. If you go in the hospital, it's probably going to be another 3, 4, 5 weeks after you get out of the hospital, maybe even longer than that, before Medicare sees the claim and reviews it, adjudicates it, and approves it. Don't worry about it. Don't worry about it. If the hospital calls you up and says, well, you owe us this, you owe us that, or sends you a statement. Actually, they'll send you a statement that says this is not a bill, but then this is not a bill is in real tiny print somewhere, or it's very faint, so you may overlook it. But you do not pay hospital bills or doctor bills or anything else until Medicare has adjudicated the claim, approved it. Otherwise, you may end up paying something that you didn't really owe, and then try and get your money back from the hospital or the doctor who did the billing. So this is Bob Vineyard with the Georgia Medicare Minute. You take care. Have a great day.